I'll talk a little bit and give you an update in regard to testing. We know that Ohio, like other states, has not had as much testing as we would have liked. We have had to ration that testing or target that testing. Dr. Acton will be issuing orders today to accomplish a couple things. Both will help increase our testing turnaround time to reduce anxiety of people who are sick. They need to get the results as quickly as possible. And I've talked about this before, but today we're actually turning this into an order for our hospitals. Dr. Acton is signing an order directed at all hospitals that don't do their own testing, which is the majority of the hospitals. Those hospitals that send their specimens to a third party. Beginning today, when Dr. Acton signs this, you will be required to send this to another hospital that is doing testing and that can make a quick turnaround for you. We have already confirmed, for example, that Ohio State, Cleveland Clinic, University Hospitals in Cleveland, and Metro Health in Cleveland all have capacity. They all have capacity, and they are willing to take your tests. So you need to be in contact with them. Some of these labs have a very significant unused capacity each day that's not really been fully utilized. And these labs are able to turn around results much more quickly than the private labs. So beginning today, you no longer will be able to send those to the private labs. And again, the problem has been turnaround 4, 5, and 6 days, which is simply unacceptable. It's unacceptable to the patient. It's unacceptable for the rest of us, because knowing when someone tests positive or doesn't test positive is information that we very, very desperately need. Let me also say that the Ohio Department of Health itself will continue to analyze tests, and these, for the most part, there's already the protocol that the hospitals know, but for the most part, these are critical patients, including hospitalized and healthcare workers who are showing some symptoms of the coronavirus. So that criteria does not change. The Ohio Department of Health is certainly open for business and certainly open to do that testing. We would anticipate that there may be other hospitals who have capacity, and as soon as we know and those hospitals have confirmed, yes, we do have capacity, yes, we can do testing, we will post those, and we will let you know about that. Let me turn to the second part about the testing, and the second part of Dr. Acton's order. You have read and heard about the rapid tests that are coming on the market. We've been in contact with some of the companies that are bringing these on to the market. We will start using these just as soon as they are sent to us in Ohio. So we know that some of them already have hospitals lined up where they're going to send those. We cannot control when those are sent, but we would anticipate this would start within the next week, and we're certainly looking forward to that. Again, depending on how much of this we have, we will be utilizing freestanding emergency departments, urgent care centers, freestanding ambulatory surgery centers, and hospital multi-use healthcare facilities that house a lab service. This will be very, very helpful. But again, stay tuned. We'll have more information once we start getting these and seeing these come online in Ohio. We will let everyone know that.